Dallas County now has 2 cases of Zika virus, of course, the mosquito-borne virus that sparked a global emergency this week.
Health officials say one of the cases was a person who came from Venezuela. The other case was sexually transmitted right here in North Texas. We're working to find out if the 2 are connected. Health and wellness reporter Sonia Azad joins us now with much more information. Sonia, this is rare.
That's exactly right. It's very rare. And first of all, we want to stress that the Zika virus is not deadly, but it has been linked to birth defects. So in this Dallas County case, the CDC says there is no risk of a developing fetus, or to a developing fetus. Still, it's very significant. It's the first time a virus has been sexually transmitted in the United States by a non-traveler. Now, according to the Dallas County Health Department, the person who is infected here, one of them, contracted the virus from a sexual partner who recently traveled to Venezuela. Scientists are still investigating whether this is transmitted through blood or semen. And the reason we're telling you that is because it would mean 2 very different things. Meantime, experts and doctors say protect yourself from mosquitoes. Don't travel to the affected areas in Central or South America, Mexico, or the Caribbean if you're pregnant or if you're trying to get pregnant in the next few months. And if your sexual partner travels to or has traveled to any of those countries, use protection upon their return.
If a person is traveling to one of those 26 countries that have been declared by the Pan American and World Health Organization to be transmitting the disease, mostly in the Caribbean and South America, they should use condoms for their sexual contacts until they are well beyond the period where they could have acquired it or transmitted it. Incubation period is probably 1 to 2 weeks. So if you've been back 3 weeks or 4 weeks, you're probably not at risk any longer.
The symptoms to most adults are very mild. For instance, a rash, a fever that can be treated with Tylenol. But this person has been asked not to have sex with anyone else for the time being.
But the good news, if there is any good news here, is that this person is not pregnant.
Right. No threat to any fetus. Because as we know, the danger really is to the fetus of a mother-to-be, because it can cause brain defects, it can cause microcephaly, which causes children to be born with smaller heads. So that's the real danger here. That's why so much over and over we're hearing pregnant women, women who are trying to get pregnant should not travel to these affected areas.